Hi, my name is Caroline Barber, and I'm a practicing registered nurse and a family nurse practitioner student at Texas State University. There has been a lot of research exploring the negative impacts of an excessive patient load on registered nurses. Burnout, poor patient outcomes, and nurses leaving their profession have all been thoroughly researched. Unfortunately, little has been uncovered about how many patients is deemed inappropriate for a healthcare provider to see within an allotted time frame. One study established an association between visit length and malpractice claims. Another study revealed that the offering of immunizations, obtaining detailed social and family medical history, and providing preventative women's health care was significantly less frequent when the visit rate exceeded 3 patients an hour. Due to national physician shortages and an ever-growing patient load, the current model of healthcare in the United States relies heavily on the support of nurse practitioner and physician assistant providers. With increased demands for access to care, patients and providers alike have voiced concerns on having adequate time for complete assessment, accurate diagnosis, and thorough individualized education where patients feel heard and providers are able to get what they need to mitigate liability. There are questions surrounding what number of patients per day would be considered a fair amount for an inexperienced provider to see. This is concerning in that patients are being pushed through clinic systems to meet target profits at the expense of the provider's comfort level and the patient care experience. While further evidence is necessary to provide optimal backing for this argument, it is my belief that to foster a safe clinical environment for both patients and providers, there needs to be established guidelines in place that impose limits on the amount of patients providers can see. I found my search for relevant evidence on staffing ratios as it specifically relates to providers to be underwhelming. The advice given as to what an ideal panel size of patients should be was ambiguous, emphasizing that practices and individual providers should not bite off more than they are able to chew. Furthermore, the instructions provided for handling an overbooked provider was reactive rather than proactive. Jam-packed clinic schedules, patient panels built primarily around profit, and the notable lack of established policy on safe patient-provider ratios has long equated to a pronounced dismissal of patient and provider needs which should not be overlooked any longer. A few potential solutions to addressing patient-provider loads include addressing the physician shortage that is partially to blame for increased clinician workload, allocating more funding towards the education of additional physician and non-physician providers, with emphasis on incentivizing graduating clinicians into roles where they will function in primary care, rural settings, and other specialties that are high in demand but less sought out is paramount. Additionally, we need to create safe and supportive work environments that protect our healthcare workers, as it is difficult to pour from an empty cup, and retention is important, especially in a time of increased patient demand. Thirdly, we need to push our federal and state politicians to prioritize healthcare policy in a way that they haven't done so in the past. Funding for various nursing programs was cut recently in Texas, and a proposed legislative bill advocating for safe staffing ratios was actually introduced in May of 2019, but died in Congress and never was enacted. These trends cannot continue as they are not in the best interest of patients nor providers, and I feel strongly that our professional organizations need to step up and be the voice of the profession and continue to advocate on a political level to make change happen. Thank you for your time.